High sugar levels in maternal circulation is associated with increased risks of adverse pregnancy outcome. And number one thing that this one can cause is it may lead to a baby having birth defects. I know you've heard of congenital malformations. Yeah. Hello and a very warm welcome to Health Talk by Achibella the Nurse. And in case you're new here, karibu sana and be part of this journey. And to those who've been journeying with me, coming back here again and again, Aki, I don't take it for granted. Asanteni sana, and I hope you guys are learning a lot. High sugar levels in maternal circulation is associated with increased risks of adverse pregnancy outcome. And that is why today I want us to talk about how these high sugar levels in the mother can affect the baby in the womb and after birth if not well controlled or managed. Number one thing that this one can cause is it may lead to a baby having birth defects. I know you've heard of congenital malformations, yeah, or we call them birth deformities. Yes, so high sugars in maternal circulation can lead to this because it alters the normal pathways of development of a baby. And this may lead to baby having several defects of the heart. I know you've heard of babies having holes in the heart and some deformities in the blood vessels, in the urinary tract system, digestive system, respiratory system, and even the brain and the spinal cord. Yeah, you've heard of spina bifida? Yes, this is what I'm talking about. Then another thing that high blood sugars in maternal circulation can cause is may lead to baby being big, or let's say large for his gestation, large for gestational age. Yes, when I say this, I mean baby becomes very big, and this is because excess glucose that is from the mother's circulation that the baby gets through the placenta are being converted into fats and stored by the baby as baby fats, and that is why the baby becomes very large and very big. Then another thing that this can lead to is preterm birth. Yes, baby being born before his dates, and this is because of the pressure exerted by the weight of the baby. The pressure that weight exerts in the mother's womb may lead to preterm labor, and preterm labor will result into preterm birth of the baby. Then another thing that these high blood sugar levels in the mother's circulation can cause is when the baby is born, the baby may go into hypoglycemia. And when I say hypoglycemia, I mean the sugar levels in the baby circulation after birth will go down. And this is because there is excess insulin, because the baby was used to getting excess glucose from the mother's circulation. And because of this insulin, the sugars of the baby will go down because the baby is no longer getting those sugars from the mother. Yeah, mtoto saizo anajitegemea. Then another thing that this may cause is the baby may have breathing difficulties. Yes, and this is because the blood, or yes, the blood that the baby was getting from the mother's circulation while still in the womb had a lot of sugars, and these sugars alters with the formation of the lungs. And so when the baby is born, the baby is being born with immature lungs, and that is why he cannot breathe well. The last but not least thing, and in fact it's the most serious thing, that these mother's high sugar levels can cause to is the baby may die inside the womb. You've heard of stillbirth? Yes. And this is because the functions of the placenta are compromised by these sugars. And you know that the placenta is what gives the baby the blood, the oxygen, the nutrients, and everything that the baby needs to survive in the womb. And when its functions are compromised, then yeah, the baby can die.